The movie shows only a small portion of the material from the examination records conducted by staff at the department. The obtained results exceeded expectations. Quantum action on the molecule requires a detailed study, since the particles can be in various space-time projections simultaneously and behave variously. Until now, we haven't had the equipment that allowed us to study this process in more detail, because the changes are in process at different levels, which is not yet available to science. Marpol V.V. Pathogenic pathway. The patient is 67 years old. A congenital upper macrognathia offset the central line by 7 mm. Mandibular micrognathia offset the central line by 5 mm, with deep occlusion. Offset the mandible with deep overlapping of the supramaxilla, with a complicated compensated form of Popov-Gordon phenomenon. Because of ineffective treatment of caries and its complications, the 24th, 25th, 26th, 27th, 47th, 56th, 45th, 17th, and 36th teeth have been removed. As tooth loss, the dental occlusion crossbite depth and face configuration have changed. Late treatment of caries with its complications, the presence of chronic infection of foci in the mouth cavity, untreated tooth roots of teeth led to frequent recrudescence. All that precipitated the radicular cyst formation in the 17th, 16th, 15th, 14th, 44th, 24th, 25th, and 27th roots of the teeth, which in turn resulted in long-term development of sinusitis and alveolar resorption in both the superior and inferior jaws. Visual inspection. The face configuration changed. Well-marked nasolabial folds, opening of the mouth on a full scale. Lymphatic nodes are enlarged, painless on palpitation. Retraction of the jowls. Examination of the temporal lower jaw joint. Audible noise, crepitus, distal displacement, deep cross occlusion. Diagnosis. Micrognathia of U-shaped type. Partial secondary edentia of the maxilla, first-class sensu Kennedy. Bilateral free-end saddle according to Gavrilov classification. Radicular cysts in the area of the 16th, 15th, 14th tooth. Atrophy of the dental arch, 3-4 type, or CD class. Recrudescence of chronic periodontitis. The mobility of the first degree of the 13th, 12th, 11th, 21st, 22nd, 23rd teeth. Mandibular micrognathia. Partial secondary edentia of the mandibular bone. Second class. The second subclass sensu Kennedy. Sixth class sensu Gavrilov. With a complicated compensated form of Popov-Gordon phenomenon, offset to the left. Recrudescence of generalized periodontitis. Deep cross occlusion with distraversion to the left. Radicular cyst in the area of the 43rd tooth root of 4 by 6 mm in size. Operation. The following procedures are carried out sequentially. Antiseptic preparation of facial skin cover. Antiseptic preparation of vestibule. Antiseptic preparation of the mouth. Nerve block and infiltration anesthesia. Incision of the mucous lining. Separation of the mucoperiosteal flap followed by alveolar bone skeletization. The doctor forms the shaped chamfer of the denture supporting area for the future implant by ceramic dental handpiece. All anatomical details are taken into account in the implant positioning. A pick-up impression of the skeletonized area of the dental arch is achieved by pre-selected and sterilized molding spoons. The molding spoon is recommended to be individualized. The patient is assigned 15 treatment sessions of quantum therapy for rapid rehabilitation in the post-operative period. The principal method of quantum therapy consists of change of intermolecular interactions, photoelectric response amplification in the cell, acceleration of DNA and RNA synthesis, enhancement of cell proliferation, improvement of microcirculation, the change of the regulation mechanisms of the metabolic process, immunity improvement, stability imprinting to stress. Advantages of quantum therapy: improvement of the effectiveness of drug administration, reducing of prescribed drug dosages or complete rejection of them, reduction of terms of a wide range of diseases, the rehabilitation period cut by 2 to 3 times, the high phylactic potential, no drug side effects, non-invasiveness, and environmental safety. The implants for surgery implantstruction represented on the model. The implants are made of a unique titanium nickeloid alloy with shape memory effect. The implants in a sterile pouch. The second stage of the operation. The implant insertion. Cooled in liquid nitrogen, the implant is installed in pre-formed chamfers of the denture supporting area under nerve block and infiltration anesthesia. At body temperature, the implant reshapes, leading to self-fixation. In this clinical event, the directional augmentation of hard tissue bio-os carried out accompanied by bioresorbable membrane interpenetration and subsequent suturation. The patient is assigned 15 sessions of quantum therapy for rapid rehabilitation in the post-operative period. Type of operative wound after 15 days. Control orthopantomogram. Orthopantomogram after prosthesis. Photo after prosthesis. Stomathoplasty, implant surgery, and implantstruction of mandibular bone. Physical examination results. The face configuration changed. Well-marked nasolabial folds, opening of the mouth on full scale. Lymphatic nodes are enlarged, painless on palpitation. Retraction of the jowls. Examination of the temporal lower jaw joint, audible noise, crepitus, distal displacement, deep cross occlusion. Patient has roots of the 15th, 14th teeth, dental rebuilding of the 13th, 12th, 11th, 21st, 22nd, and 23rd teeth by porcelain fused to the metal crown. The mucus tunic in the 15th and 14th root area is hypertrophied and hydropic, with obvious hyperemia, evident cyanosis. Atrophy of the dental arch of the 3rd and 4th degree, macrognathia. Teeth of the lower jaw, atrophy of the dental arch of the 3rd degree on the left, micrognathia. Using the software program developed by our experts, the doctor predicts the operative plan, the placement location of implants, their size and type, with allowance for this mandibular nerve localization, importantly in this clinical event. The height of hard tissue in the posterior mandible from the gingival crest to the inferior dental canal is 5.6 millimeters on the right and 5.7 millimeters on the left. It's a determinant factor for the implant's choice and to select the implant structure process. The implant shoulders are made in accordance with the configuration of the jaw ridge bone. The implants are reduced in height, but they remain resistant to transversal loads due to the large endosseous area. Key factors determining the choice of implants and their positioning are as follows. Micrognathia. Thin and poorly supplied mucus tunic. A small area of attached gingiva. Hypertrophy of the soft tissues of the buccal region. Height increase of gingival crest of the mandible. Height reduction of the alveolar portion without sacrificing horizontal dimensions. The dehiscence of alveolar arches in the posterior areas of more than 1 centimeter. Third and fourth phenotype of hard tissue architectonic. Using our software program, the surgical template is made for installing 4 superline implants in the mandible anterior region, according to the computer tomography. Operation. The following procedures are carried out sequentially. Antiseptic preparation of facial skin cover. Antiseptic preparation of vestibule. Antiseptic preparation of the mouth. Bilateral mandibular nerve block, sensu go gates, and bilateral blocking of the mental and incisal branch in the Malamed modification. Incision of the mucous lining, followed by separation of the mucoperiosteal flap. Removal of the 43rd and 33rd teeth. Surgical debridement of sockets, granulation tissue erasion. The wound is irrigated by normal saline. Surgical template installation. Dental arch preparation by a pilot burr, followed by increase to the desired size and diameter. The implants installation. The chamfer of denture supporting area forming in the right posterior area. Installation of the cooled in liquid nitrogen implants. Positioning. The chamfer of the denture supporting area forming in the left posterior area. Installation of the cooled-in liquid nitrogen implants. Positioning. Saturation. Quantum therapy. Clinical response to quantum therapy. Immunity improvement. Apomorphine generation. Complete regeneration of damaged tissues. Improving the blood rheological properties. Elimination of the perioxidation stress effects. Improving of blood properties. Anti-inflammatory properties. Anti-edematous action. Improvement in tissue trophism. Increased pain limit. Improvement in the microcirculation system. Biological effects. Activation of protein synthesis of DNA and RNA. Increase in production and activation of enzymes. Improvement of nerve fiber conductivity. Recovery of specific and non-specific immunity factors. Increase in ATP production. Enhancement of collagenation. Decrease in cholesterol. Recovery and strengthening of prostaglandin synthesis. Recovery of prostaglandin synthesis. Recovery of lipid peroxidation process. Potent antioxidative activity. Warming the surface layers of tissue architecture. Effects on receptors located in the skin. Strengthening of laser penetration into the tissues. Improvement of cell energy potential. Types of action on the body by means of the Richter S-Mill device models. Transcutaneous electrical nerve stimulation. Low-intensity pulsed coherent laser radiation with 890 nanometers wavelength. Broadband pulsed infrared laser radiation of 890 to 960 nanometers in the wavelength range. Pulsed laser light of 640 to 740 nanometers in visible wavelength. Pulsed laser blue light in the visible wavelength. Magnetic field intensity of 35 milliteslas. As consistent with the target goal and set tasks, the work was carried out in two ways. Investigation of the functional and anatomical state of tissue characters induced by quantum therapy. Investigation of the functional and anatomical state of tissue characters induced by standard treatment. The present study was carried out on a Richter IV device, taking into account its most important clinical properties of electromagnetic radiation, analgesic action, improvement of tissue trophism, improvement of tissue structure microcirculation in superficial and deep layers. The safety of the Richter IV device is confirmed by the relevant certificates and licenses issued by the Russian Federation's Ministry of Healthcare and the State Committee for the Russian Federation of Standardization and Metrology. Development of the clinical trial plan. The present study was carried out for the purpose of estimation of the quantum therapy effectiveness in maxillofacial surgery and implantology. The procedures are underway in the physiotherapy cabinet of the Department of Pediatric Surgery and Rehabilitation at the Alexandria International Medical Center for Dental Implantation and Implantstruction. To determine the treatment effectiveness, the Scoring Express system SensoTrink in the modification department was used. The status of patients was determined by 3 characteristic groups, including modifications in clinical, instrumental, and laboratory parameters, subjected to randomized treatment and factor analysis. The integral estimation is determined by the sum of points dialed. Any complication of treatment and collateral damage after quantum therapy are undefined. Ethical issues do not arise. All patients were 21 to 80 years old. The main group after implantation included 70 people. The control group was 20 people. The study group after surgery, directed hard tissue augmentation, and the maxillary sinus reconstruction involved 52 patients. The control set consisted of 16 patients. Materials and methods. The irradiation of different frequencies and wavelength ranges at the implant location area was carried out on the patients in the post-operative period after implantation, 70 patients. The control set, 20 patients, received common medication. Also, the irradiation of different frequencies and wavelength ranges combined with electrical stimulation in the surgery area was carried out on patients in the post-operative period after directed hard tissue augmentation. 52 patients, 15 sessions, duration of manipulation, 20 minutes. The control set consisted of 16 patients. Any treatment complications and adverse reactions after quantum therapy are undefined in all cases. Any changes in devices during the process of research and in the future have not been undertaken. The results of obtained analysis confirmed a high efficiency of quantum methods of influence on the pathological centers. Any complications in treatment and collateral damage after quantum therapy are undefined in all cases. Drug therapy in the study set was not applied. After treatment, patients are examined at the Department of Pediatric Surgery and Rehabilitation at the Alexandria International Medical Center for Dental Implantation and Implantstruction. Any complications of treatment and disease recurrence are undefined in all cases. The primary outcome measures of the study were 100% implant osseointegration with the formation of ankylosis. The beneficial effect of a 100% osseointegration of bone material after directed hard tissue augmentation are observed. This is confirmed by the control spot films, orthopantomograms, and digital volume tomography, as well as laboratory studies. Special precaution measures are not applied. Pathological changes in the tissue. The epithelial cells of the mucosa. Microscopic view of a histologic specimen. A. Prior to laser therapy, treatable. Abnormality of the horizontal cellular signaling. The cell organelles are diffuse and unstructured. Large intercellular spaces. Microscopic view of a histologic specimen. B. After laser therapy, treatable. Cytosolic membranes are closely structured. The cell organelles are well differentiated. Intercellular intervals. Slit-like. Cellular connectivity. Dense. At the second figure, intraoperative mucosa biopsy after a course of quantum preoperative preparation. Ample quantity of phagocytes with the characteristics of active phagocytosis. Mitochondria are well-rounded with a bright lateral definition. Chromatin is concentrated. Electron microscopy. Changes in the tissue. The slices are colored by hematoxylineosis. The epithelial cells of the mucosa. Slices 2B. Slice for the control group after the 5th day. The slice shows single fibroblasts, the swollen endolithium in vessels. Slice of control set, 5th day. Stromal edema, vascular distension, single erythrocytes. The control group after the 4th day. Fibroblasts, single perivascular segmental leukocytes, stromal edema. The control group after the 7th day. The vessel with margination in the lumen, fibroblasts. The control group after the 9th day. Fibroblasts, leukocytes in the lumen of vessels, single lymphocytes, local resuscitation of blood flow. The control group after the 9th day. Fibroblasts, leukocytes in the lumen of vessels, single lymphocytes, local resuscitation of blood flow. Slices 2C, the 2nd day after quantum therapy. Saturated infiltration by the segmental lymphocytes of the stroma and epithelium. Acute vasculitis in the vessel. The 5th day after quantum therapy. Treatable. Productive phase. A great number of plasma cells. The active proliferation of fibroblasts. Large numbers of lymphocytes. The active collagen formation. The 5th day after quantum therapy. The remission of inflammatory response. Quantity reduction of cells. The active collagen formation. The 5th day after quantum therapy treatable. Productive phase. A large number of plasma cells. The active proliferation of fibroblasts. A large number of lymphocytes. The active collagen formation. The 5th day after quantum therapy treatable. The remission of inflammatory response. Quantity reduction of cells. The active collagen formation. A large number of plasma cells, a large number of phagocytes, the active collagen formation. The remission of inflammatory response. A large number of lymphocytes, plasma cells, phagocytes, the active collagen formation. The cells are arc-structured with a bright lateral definition. The remission of inflammatory response. Leukocytes in the lumen of vessels. A large number of plasma cells. The cells are arc-structured with a bright lateral definition. Results. The advanced therapeutic potency of quantum therapy with use of the Richter IV device in the postoperative period in reconstructive maxillofacial surgery and implantology. Deviations from the clinical investigation plan were absent. Complications of treatment and collateral damage after quantum therapy are undefined. Summary. The efficacy of quantum therapy outlined in the clinical trial protocols. Survey indicates the high effectiveness of quantum technology's application in reconstructive surgery, maxillofacial area, implantology, and implantstruction. Beneficial effects of photomodulation, osteogenesis, and periodontium tissue is observed. This results in rapid rehabilitation of patients in the postoperative period. In such a manner, the clinical relevance of the Richter IV device is proven. The achievements of quantum medicine in its 20-year history suggest that it will determine the health of humanity in the future.